Trickett.
The government's health strategy is clear. Whilst health demand rises, the amount of resources being provided to the NHS is declining, which leaves well-heeled patients with nowhere else to go to avoid ill health except into the so-called independent sector. An example is a constituent who told me that his opticians had said he could wait 6 years for cataract operations, by which time he'd be nearly blind, or he can go and pay for a cataract operation now in the private sector. So even before COVID, they had cut the health budget spending. In Britain, we were spending £2,000 per head of population less than was being spent in Germany. There were cuts to the numbers of staff and their pay as well. 100,000 vacancies, 17,000 fewer hospital beds, over 100 fewer A&E facilities, and hospital waiting lists therefore doubling even before COVID arrived since the end of the Labour government. This bill continues all of that process as you would expect. The bill will make the NHS more remote because it's top down, and it's a Trojan horse for elements of privatisation. Newly remote administrators will have little sensitivity to local health requirements. Think of the differences between the health needs of former coalfield communities such as I represent in West Yorkshire with the inner city of Bradford or the relative affluence of Harrogate. Yet all of that is going to be covered by a single new board. And then centralisation of clinical services makes them less accessible. I have 20,000 people living in my constituency with no car to their household's name and with poor public transport, many of them with chronic health needs. How on earth will they be expected to travel to centralised services in Leeds or elsewhere under those circumstances? Deputy Speaker, there are two competing views of health provision, really facing each other now. Either health is about an ethos of care or it's about making money. This bill leans in one direction. The government don't want to fund the NHS properly, so they're trying to entice more private money into health, often from sources which we know fund the Tory party. But privatisation puts one person's wealth in front of another person's health. And look at the pages of the American health service providers today, salivating at the prospect of growing NHS waiting lists. And now so-called independent providers are to be invited to sit on boards which actually manage the NHS budgets. Yet the idea of profiteering from someone else's ill health is repulsive to most British people, yet it's intrinsic to this bill. You can only call it one thing, which is parasitic capitalism. Along with the RCN, the BMA and many other practitioners, we must resist the creeping destruction of our NHS.